Just I want to give you some idea about the shoulder region. This is confusing. Shoulder region has a 3 parts, or a region of the upper limb which is connecting to the trunk. So it has anterior part is the pectoral part, shoulder region, and thus lateral part means upper part of the humerus, and posteriorly we are actually discussing about scapula. So we are dividing today, we are going to discuss about the shoulder region as a whole, but again it's a combination of scapular region means a part of the shoulder region, and also back, we are going from down. So don't be confused about this point, because one of the student, he came and he asked me, Dr. Shahzad, it looks like this is a repetition. Yes, it looks like, but what I am saying, again I am repeating, the front is pectoral and a back. Dr. Mujahid will take the lecture on this pectoral region, and on a back is scapular and the lateral upper part, and it is also containing a proper shoulder joint. So next lecture I will discuss, and here just is a repetition. Back means is a scapular region. It's not working. Okay, so these are the objectives. Just focus over here. How many things do you know? Just assess yourself. Don't talk to me. Assess yourself. 10 seconds you have. I think we have discussed this one. This was a long topic. And here curvatures. Have you discussed about the vertebral column curvatures? No. Okay. So vertebrae you know well. All of you know well. The vertebral joints, little bit I have discussed about the vertebral joint. And the muscles of the back already we have discussed, but again I am saying you have to discuss mostly, what is this one? Superficial. Only I need from your side a superficial. And this superficial can be divided. What is written over there? Connecting the vertebra to the scapula. Means scapular region with the back. This is our main, topic. Look at it, it's not a difficult. Already we have done cervical, thoracic, lumbar, sacral and coccygeal. There are a lot of points on which you can differentiate this cervical, thoracic, lumbar and sacral from each other. So, but I gave you the ideas, how can you differentiate? Can you differentiate the coccygeal and sacral? Sacral are fused and coccygeal also. This coccyx actually are 4 in number, they are smaller. And these are again fused, so you have to differentiate this and this and this one. How can you differentiate the cervical? On the basis of, what is the name of this one? I will come on again on differentiation. What is this one? Just have a review. Body. And what is this? Pedicle. And what is this one? Lamina. What is this? Lamina. And what is this? And this is? And what is this one? Superior articular process. And this is? They are making a joint with other vertebrae. Where are you going?
Just checking someone calling me.
No need, just
No, I'm coming.
switch off this mobile.
Okay. 2 minutes only.
This one is spinous process, we know, and this is inferior articular process, which is uniting with the superior of the inferior vertebra. And here, do you know this one? This is the notch, vertebral notch. Okay, I will ask you one more question. Now you have idea this one. What is vertebral foramen? You know, what is vertebral foramen? The foramen in a one vertebra or behind the body, or this vertebral foramen is surrounded by these structures. On the lateral side, pedicle. What is the difference between vertebral foramen and intervertebral foramen? Is the same thing or different? Listen. What is the difference between vertebral foramen and intervertebral foramen?
Vertebral foramen, where the spinal cord
Is present, yes.
and intervertebral foramen, where the spinal
Nerve
spinal
comes
nerve
out.
Goes out, yeah.
Are you agree with that? Intervertebral foramen is on the side. On the side. Over here. So spinal nerve will come out through this one. Actually, this is formed by the two pedicles, upper and lower vertebra. Here, this is the pedicle, and here will be another vertebra, and in between this one, two pedicles and body, and behind is articular process. You will find, you can complete a foramen over here, and through which the nerve is coming out. Are you getting my point? Is it clear? So intervertebral foramen, intervertebral, between two vertebrae, they are on the side. Okay. Now you can differentiate very easily. Look at this on the basis of, are you able to see this foramen over here?
No.
This foramen is present. This is known as a vertebral foramen in all vertebra. This is lumbar, this is thoracic, and this is cervical. So how can you differentiate? On the basis of very simple. This foramen is not present here and here. It's only present in cervical. There are other points. There are other points. If you see the spine of this one and this one and this one, you can also differentiate on the basis of spine, not transverse process. This spine is bifid. The end and the tip is divided into two parts. And if you see over here in a thoracic area, what is this one? Facet for rib attachment in the body, and over transverse process. This is for the attachment of the rib. And here you are not able to find. So this is known as, and how about this one? Anterior posterior diameter is more as compared to the transverse in thoracic, heart shape. And if you see the body, this one is more transverse as compared to the anterior. And another point is more thicker. This one is a more thicker, simple. Make it, there are a lot of points, but you should know, you can differentiate if I will give you in an exam. Either this one is a cervical or thoracic or lumbar in OSPI. Huh? So I think you can easily differentiate these vertebrae. Okay, now here, look at this now. You can see on the side, what is this one? Pedicle. What is this? Pedicle. And this is articular process. And you can see over here, there is a foramen. What is that foramen? Intervertebral foramen. So the intervertebral joints, very easy. How many synovial joints are there? 4. What are that? Right and left articular. Are you getting my point? These are synovial joints. Superior articular process, superior. If you take this vertebra, you can see it's making a joint over here and over here. Right and left. How many? 4. What are these? Between articular processes. Very simple. And these are synovial joints. And how about this one? 2 symphysis means intervertebral joints are secondary cartilaginous joint are known as symphysis. Symphysis. Symphysis pubis is a secondary cartilaginous joint. And here we have secondary cartilaginous joint between bodies. So these are two number. Each of the vertebra is making these joints. Is it clear to everybody? Yes. Synovial joint is between articular processes. Superior articular process and inferior. Have you seen in a lab? This is the problem. This is the problem.
We saw some parts of the vertebra.
Half of the student. Half of the student, they are, I don't know what they want to do. Still, the last, row, they are still playing with their mobile. Please go out. If I see, yes, you are playing with the mobile, you cannot sit in my class. What I am talking? Huh? What we were discussing? What was his question? Yes, you the last one. Then you are saying, please repeat again, repeat the lecture. And leader are wandering outside, they have calls here and there within 2 minutes, that's this. If you have an emergency and there, what was my topic, do you know? Yes, another with the cap, the last one. Yes. MashaAllah, second year students, huh? Articular process is present. They are 4 in number, 2 superior, 2 inferior, right and left. And they are present at the junction of, yes, leader. What is articular process?
It's in the thoracic vertebra, that's superior and lower.
It's only thoracic. Are you agree with him?
In the body.
Huh? It's only in a thoracic vertebra. It's only in thoracic vertebra. If you will say this one, I will give you minus 20, huh? Not minus 20, minus 10. Yes.
I know in all vertebrae.
Sure? Where they are present?
In the after the body. In the
yes. Another leader. To make attachment with another vertebra. If you take one vertebra, where they are present? Which is the location? At the body, at the spine, or at the?
At the junction between the pedicle and the vertebra.
Huh? You have a marker? Please. Be serious. See one time in a lab. No need to see these things. Really, I'm saying.
We didn't take the lab, sir.
This is the problem. Ask from your leaders. Today you have. That's good. No problem. We will see, inshallah, arrange. Today we have a lab? Okay. Look at this, please. I am showing you. If you are not able to see from the back side, please ask from me. This is the body. And from the body posterior side, this is the anterior side, this is posterior side. On the upper side, you will see there is a pedicle. And from pedicle, you will see there is a lamina. And from lamina, there is spine. Spine, lamina, and what is this? Pedicle. At the junction of pedicle and lamina, you will see the up and down articular process. At the junction of lamina and pedicle, superior and inferior. Please, one more thing. Here is listen first. Here is the pedicle, here is the body. I will make the body now a smaller one, please, and show you the back side more. A two view, I will show you two views. Look at this. First, again I am repeating, please here. It's very simple. Please see here. This is the body. I am showing you from the superior side. From the body you can see from the back side there is a pedicle. What is this? Pedicle. And from pedicle towards the medial side, very good. What is this one? Lamina to lamina. And from the junction of lamina you will find the spine is on the back side, and here is the body on the front. This is the vertebral foramen. At this level you will find superior and inferior articular processes. Now again the lateral view please. Here is the transverse process. If you see the pedicle, you will see these are the transverse processes, and here is the body, transverse processes. Very simple. And here you will find superior articular and inferior articular process. I will show you here, please. See here. Don't see here and there for 1 minute. Focus over here. From the lateral view again. Here is the body. I am making this body now smaller. From the back and upper side, not whole, you will find pedicle, and from the pedicle you will find lamina, and from here is the spine. At the junction of pedicle and lamina you will find superior and inferior articular process. And like this one, another body, and here you will find, what is this one? Pedicle, lamina, spine. And this is superior making a joint with upper inferior one, making a joint. And like this one, you will find all the joints. So how many joints are present over here? 4. 2 above and 2 on the lower side. Is it? These are synovial joints, and these joints are cartilaginous joint. Simple. Between the body, between the articular process, what kind of the joints are there? Synovial. These are synovial joints. Is it clear? Yes.
Can we say the articular process within the vertebral arc?
Yes, you can say, no problem. Vertebral arch, how a vertebral arch is formed? Pedicle and lamina. So the articular processes are present, again I am repeating, they are present at the junction of pedicle and lamina. Clear? At the junction of pedicle, and this is the lamina. Here is the articular process. This is the pedicle. Here is the superior, here is the inferior. So you can see over here, these are the joints. Is it clear to everybody? Okay. So simple is that. So now another thing. Were you able to see this point here? From this side? Okay, now another view. I want to discuss another point. What is another? The ligaments. Ligaments. Read here. How many ligaments I have written? I explain you, very simple. It's very simple. Look at this. You can discuss, you can give the name according to, now you are a scientist. Look at this. What is this one? Body. What is this? Please. It's not a difficult. See the names of the ligament, please. What is this? Body. Everybody is able to see from the back side? Please. What is this one? Pedicle. Body. And this is lamina. And here is articular process. And okay. Another vertebra. If I am going to put the ligament over here, The blue color. Between two spine, what should be the name? Focus here. See the names. What should be the name over here? Huh? Interspinous. The last one. Interspinous. Between two spine. Ligament. If I am putting a one ligament on the tip, what should be the name of this one? See here. Supraspinous ligament. Very simple. If you want to put the needle over here, in this area, here is the spinal cord. So how many ligaments you will puncture? What are that? Two. Very good. First will be, if you are putting a needle from here, supraspinous, and then interspinous. Then you will approach into the, because there is a gap on the back side. On the back side, there is a gap on the back side. So you can approach into the vertebral canal. You are approaching into the vertebral canal just to drain the CSF, cerebrospinal fluid. Is it clear? So these are the ligaments, very simple. So which ligament now you want to see? Ligamentum nuchae. Is there any ligamentum nuchae? Ligamentum nuchae is the other name of supraspinous. This ligament above the spine. Supraspinous ligament, other name, but only in cervical area. Where? In a neck area, only. The thick and the very strong. This is known as, the knuckle line over here? Knuckle line in a skull?
Yes, look.
Okay, so here is the ligamentum nuchae on the back. What is the name of this one? Very simple, supraspinous ligament. So how many you have done? You want to cover, you want to close all these things. You want to close. Now you are also putting a ligament between lamina to lamina. Between lamina to lamina. Not between spine. See my here. See my hands over here. What is this one? Lamina. And what is this one? Spine. Can you come over here? Two students, yes. Just please, one more thing. Just, you should have an idea actually. Just make a lamina over here. And put over here. Like this. Show them. Here is the, sorry, you can sit. No problem. Are you able to understand what is this one? See here the lamina. What is here? Spine. What is here? Don't see these hands. These are the pedicles. What are that? Pedicle. And then? And what is this one? Spine. And what is over here? Spine. Between the spine, what should be the name of the ligament? Interspinous. Between the lamina, what should be the name of ligament? Ligamentum flavum. Is it clear? Look at this. What is this one? Lamina. And what is over here? Spine. Between the spine, what should be the name of the ligament? Interspinous. And what should be the name of the ligament which is present between lamina? Ligamentum flavum. Is it clear? Thank you very much. So I will show you in photographs. That's why I am saying we are feeling a difficulty to explain in a lecture. When you will see in a lab, hardly it will take a 10 second. 10 seconds, really I am telling you. Look at this. This is, you are not able to understand over here. What is this view? Posterior view. What is this one? Ligamentum flavum. They have removed that's spine. They are showing you a section. So they are showing you between the lamina. Okay? Between the lamina. So here you can find, what is the name of this ligament? Interspinous. What is the name of this ligament? Supraspinous. Between the lamina, between the two lamina, these ligaments are known as ligamentum flavum. Simple is that. So you are closing all these things. So what we have done, and here in the neck area, supraspinous ligament, supra, not interspinous ligament, this ligament is very strong, a large one. So it's not a smaller, not only on the tip, it's going out slightly. So what is that called? Ligamentum nuchae. This ligamentum nuchae is over here, and here we have done the ligaments. Please, here we have done the ligaments. How many ligaments are there? Anterior longitudinal, yes, it's very simple. Leave that. These are the difficulties. Ligamentum flavum. You know the ligamentum flavum? You know the supraspinous ligament? Ligamentum nuchae? It's also the same one, supraspinous, but in a neck area. What is this? Interspinous, between spines. Now, anterior longitudinal ligament, posterior longitudinal ligament is actually, this ligament is uniting the body. It is present in front of the body, here, very simple. And back of the body, what should be the name of this one? Anterior longitudinal, what should be this one? Can we say this is present in intervertebral, in the vertebral canal? This is present in vertebral canal? It is present, near to the spinal cord? Yes, this is the vertebral canal, not column, canal, tube. By the intervertebral foramens, by the vertebral foramens. By the vertebral foramens they are making, not intervertebral, by intervertebral foramen they are making a canal. Is it clear? Okay, so come to another point. Yes, very important. One of the patient comes to you and he is saying, where were you? Why? During lecture, don't go there. If somebody calling, just they have to ask from me. Okay, please. What I am saying, how many curvatures we have? Normally, when the newborn is there, you will find only one curvature, a C shape, vertebral. During just not newborn, intrauterine life, at the embryonic period and fetal period, in the early stage, you will find there is a curve of this vertebra is like this one. These vertebrae are C shape. Now you will see that the newborn, when he is trying to hold his head at about 6 or 5 months, or maybe earlier, he is able to hold the hand. You will find there is a one curvature over here, the front. Before that is only one curvature. Now at the level of cervical area, you will find there is a curvature here. These are known as a secondary curvature. What is this? Because they were not present at the beginning. They are developed after the primary is present in the development period. And this one is developing when the baby is able to hold, and when baby is able to stand, then there will be a lumbar curvature. Normally these vertebral column curvatures are like this one. When you will find there is a one front curvature is coming like this one, it is present in cervical area, and there is also front over there is also in lumbar area when the somebody is able to stand. So these are, now I am telling you, one of the patient comes to you. This is known as a lordosis. What is that called? Lord is not going like this one, king. He is not going like this one. King should be strong, or leader of the army should be strong. He should not be like this one because he is the fighter. So he should stand like this one, a front curve. What is that? Front curve. So where is the front curve? Here. That is known as a lordosis. What is that called? One of the patient comes to you and you will see he's complaining, doctor, I have a problem in my arm or something. You will take the X-ray of this one. and you are writing, if you are a radiologist, you are saying loss of lordosis. Loss of, what do you mean by this one? Means there is no curve here, so now it's becoming Sida. When you will say the neck, the curve is straight, this is the problem. It means something is wrong over there. Maybe the gap is less, maybe the compression of the nerves are there. So these curves are very important. These curves are, there are a lot of other, the clinical aspect. Again, I'm repeating, I'm talking only two things. This is known as a primary curve. And how many secondary curves are there now? Two in our body. What are the two secondary curves? Where they are present? In cervical and, so this is known as a lordosis. Okay? And here is the front curve. So this is the primary and this is also primary. Is it clear? Yes.
Are the curvature caused by modification of intervertebral disc?
Yes, there is a intervertebral and there is a size of the vertebral body and something. This is due to this one. When you are holding, and some postures, they are changing according to that. Holding. Because this is actually your axis. However, you are sending your weight through this line. I will give you one idea. Just look at this. One of this, again, come here. One of the joke, this. Not joke, is one of the practice. So you have to try in your home also. Can you stand like this one? Touch your leg, please. Touch your leg over here and touch your, give the support full. And raise your this, raise your leg. Please, raise your leg.
Left one?
This one. Yes, yes. No. It should be touched with. Yes.
It's very hard.
Don't hold this now. Yes.
Can't.
Yes. He cannot. Because he cannot. Even we have a lot of supports. If you are touching your this leg and this leg, you cannot put your force over there. You have to tilt. You have to make a balance. So this is the curves and everything. So our weight, yes, please, thank you very much. So what I want to give, this, there is a lot of anatomy. Really, I am telling you, but just, you should be very fast. I will give you a lot of, things. Still we are on, this articular process. I am not blaming to you. We are thinking only, means 70%. So how can I, teach you these things, gravity and force of gravity and something, central gravity. So this is physics actually. It is present in your books actually. It's very nice. So you are now medical students, should not focus only these small things. You should ask, the advanced questions, please. Don't, you are only searching only for the marks, you have to do your post-graduation. When you go to the outside, they will ask you about these, why this one, the person is not able to stand when he is touching his leg and, arm. What is the reason? They are giving like this one, the questions. So don't, spend your time only these small things. You can study yourself. And don't miss the lab, please. Okay, now come to the other point. Lecture are also important to make the concept. Very important. Okay. So these joints are clear to everybody? Okay. So ligament we have done. Ligament of the vertebral column, ligamentum flavum, and these ligaments and body movements we have done already, circumduction and something. Organizing of the back muscles, yes, please. It will hardly take a 5-10 minutes and it's not a difficult. Focus over here. Then I will give you the 5 minutes break and we will start our shoulder region. It's very important, please. Very interesting. Again, like this one, I will give you some tips. And look at this, organizing of the back muscles. How many we have? Superficial. Just focus only superficial. Leave this one, the deep muscles, I will give you one example only. Erector, spiny. Erector, spiny means vertebral column, spine, vertebral column. Erector is keeping this spine Sida. Erector, spiny. What are that muscles? I will discuss in the last. No need, even the books are saying no need to study about the origin and insertion. Do you know origin and insertion? Yes, superficial group of the back muscles connecting the, this is our main topic, vertebral column with upper limb. Just focus on two muscles. What are that? Trapezius, latissimus dorsi. They are coming from superior nuchal line, means from here, from skull, and from external occipital protuberance. Touch your external occipital protuberance. Touch his external occipital protuberance. Your front student. Touch. Yes. Where is the external occipital protuberance? Is at the junction of neck and head. At the junction of neck and head. There is a small elevation, protuberance, elevation. And that elevation is on the occipital bone. And what is this? Superior nuchal line. Here is a nuchal line, here in a skull. And what is this one? Occipital and ligamentum nuchae. You know ligamentum nuchae? From there. And how about this one? Spinous process of 7th and 12th thoracic. Very simple. Make it simple now. This is the origin. Look at this. I am trying my best to give you idea. Please. These are the spines, and these spines are containing which ligament? Ligamentum nuchae. And what are these? Thoracic spine. All these thoracic and cervical, and this in the skull, this is giving the attachment of muscle. What is that muscle? Trapezius. And then this trapezius muscle, it is going to the spine, acromion process and clavicle. Like this one. Here. This one is an insertion. Fibers are going like this one and like this one. Please. This is known as a trapezius. Again I am repeating. We are talking about, please, we are talking about superficial muscles. How many superficial? We need only these. Don't focus. Just delete for a time being. There is nothing. Only we have superficial muscles. What are that superficial muscles? I need from your side 4 names. 4 names. You know one. One is a lady, sorry, latissimus dorsi. What is this? Latissimus dorsi. This one is on the dorsal side. This is the latissimus. And again look at this. Look at this. This one, a very big muscle. Again from the spines. They are going to the humerus. These fibers, this muscle is going to the humerus. Where? In the bicipital groove. From here, look at this. From here to here. From here to here. So these are 2 superficial or deep muscles? Okay, I am talking about only superficial. Don't be confused, because one of the students came to me. He asked me very nice question. Because my time I am focusing only superficial muscles. Please. After removing these 2 superficial muscles, you will find 2 deep muscles. Don't say the deep muscles. Please. Don't think about these deep muscles. They are still superficial. Are you getting my point? Please. This is the point to understand. And then your life will be easy. Focus only 30 seconds. What I am saying? After removing, now you are a surgeon, you are removing the skin. What are the structures are there? Trapezius and latissimus dorsi. After removing this one, you will find, after removing this, we have removed from the right side. You are not able to see all the muscles. You are looking only these muscles. After removing this one, you are able to find 2 other muscles. What are the 2 other muscles? Rhomboid, major, and rhomboid. Some books are saying rhomboidus, no problem. Rhomboid, minor is on the top, and major, the big one, down. But all these are superficial. What are these? Superficial muscles. Don't be confused. How many superficial? These superficial further divided into 2 parts. What are that? Deep and superficial. So leave that, because this is a confusing point. You asked me, that's why I'm saying all these 4 muscles which I have discussed are superficial. One more muscles, you know, that's Dr. Mujahid, I think, have discussed in neck region, is known as levator scapula. This is also superficial muscles of the back, and they are going from spine to the upper limb. So make it simple. What is the heading? Superficial group of the back muscles connecting the vertebral column with upper limb. Is it clear? With the upper limb. Is it, these muscles are connecting to the upper limb or not? Yes, this is also connecting to the upper limb. So how many muscles we have done? I will repeat in a 10 seconds. Trapezius, the big muscle, latissimus dorsi. After removing these 2, you will find 3 other muscles, rhomboid minor and rhomboid major, which is connecting to the scapula to vertebral column. Okay, I'm not going in a detail which part of the spine, deep to these muscles, and this is known as the levator scapulae. These are superficial muscles. No need to discuss intermediate. This slide I have a slide, but I'm not going to explain you. No need. Okay. Now come to the deep muscles. This is intermediate. No need. We will discuss later on after discussion of axilla. I will give you a tip, inshallah, you can understand yourself. Now deep group of the muscles, please. Look at this, please. Try to, I'm going again and again. What is this one? Deep are further divided into 3 parts. How many parts? Deep. Deep are divided into 3 parts. Don't mix this one. Deep muscles are divided into, not superficial. Superficial only 5 muscles. These are superficial. These are superficial. These are, and these are superficial. After removing these 5, you will find intermediate. Remove that. You will find the muscles which are present along the vertebral column, not connecting to the scapula. Not connecting to the scapula. Look at this. What are that? Deep group. How many parts? Superficial, intermediate, deepest. No need to discuss. Is it clear to everybody, this heading? Is it clear? Because this is confusing. So deep muscles are, please switch off your mobile, please. No need. It's over here, please. You can see after a few minutes, no problem. What is that? You know, that's, I will show you. Erector spinae. What I'm saying? These are the erector spinae. They are not connecting, the muscles are not connecting to the upper limb. They are only present around vertebral column. So they are known as deep muscles. They are further divided into 3, but I need from your side only one, you know, erector. Where is the erector spinae? Here is the erector spinae, most superficial of the deep group. Here, the deep group, the most superficial of the deep group. After removing this, you will find the intermediate, then deep, no need. I need from your side the deep muscles, only one memorize. What is this? Erector spinae. And these erector spinae, see the around the erector, they are 3, just name 3 names, only names. Only names. And you can give the names yourself. I will give you one name and the other you can decide yourself. Look at this. Think about for few seconds. What is this one? Ilium. From ilium to the vertebra, from ilium to the ribs means costal. What should be the name of this muscle? Iliocostalis. Very good. Now we are running from lateral to medial. Leave this muscle, and this is around the spine. What should be the name of this? Spinalis. Simple. What should be the name of this? Iliocostalis. What should be the name of this one? Spinalis. And in between this one is known as longissimus. All these 3 are known as erector spinae. Is it clear? Is it clear to everybody? If you want to ask, please. This is the last point I am discussing. So I will explain you now again. Very simple. Very simple. On the back side, after removing the skin, superficial fascia, deep fascia, you are now going to the... Please, I was surprised actually. in my PBL group, they are not able to explain me what is deep fascia. Do you know deep fascia? Deep fascia is very thin but very strong. It's a connective tissue. Look at this, please. Again, basic things. After removing the skin, you will find one complete layer of the fat. This fat is connective tissue. They had also, some other kind of the tissue, a complete, very thick, like this jacket, a very thick. That is known as superficial fascia after removing the skin. And then superficial fascia is very thick. This one is a thin or this one is a thick? Yes, already I gave the answer. This is the thick, and what is this one? Thin. So you will find superficial fascia and then deep fascia. After removing the deep fascia, you will find muscles. Are you getting my point? Muscles. Deep fascia is very strong. Okay? It's very thin, but it's strong. Not so strong, but it's strong as compared to the other superficial fascia. So, rector spinae, here are the muscles. So, look at this. This is the rector spinae muscles. What should be the name of this muscle? Iliocostalis. Very good. What should be this one? Spinalis. What should be this one? Longissimus. Simple. So all these muscles are known as? These are the deep muscles. So what I have discussed, please, what I have discussed, if you are going to dissect the dead body, what should be first? Skin. Remove the skin and then backside. Then superficial fascia. Then deep fascia. After removing this one, you will find the two very big muscles. What are that big muscles? Trapezius and latissimus dorsi. What are their nerve supply? I will give you idea. And okay, you know the latissimus dorsi, trapezius muscle. And after removing these two muscles, what are that other three muscles? Rhomboid minor, rhomboid major, and levator scapulae. And these three muscles are also superficial. These five superficial. And then you are going into intermediate, no need. What are the deep muscles? Rector spinae. They are only around the vertebral column, not connecting to the upper limb. Is it clear? So what is the nerve supply of trapezius? What is the nerve supply of trapezius? You know well. It's the 11th cranial nerve, spinal part. C3 and C4 also from vertebral column. Okay? These are the actually nerves which are supplying to that. What is the action of this one? Come here. Come. Now action of trapezius muscle. You have to raise your shoulder up one side, not on the left side. Give a force on both sides. His left trapezius damage. So he is not able to shrug the shoulder. You have to give the pressure and ask from the patient. He want to elevate the this scapula up due to the action of trapezius. Which nerve is damaged now?
Accessory.
Cranial nerves, 11th accessory part. Accessory cranial, spinal part, sorry. Accessory nerves, spinal part is damaged because it's supplying to the skeletal muscle. So this is the action of trapezius. How about the lady, means latissimus dorsi? What is the action of this one? And what is the nerve supply of this muscle? See here. You know, from posterior cord there is a very long thoracodorsal. Ultra, you know ultra? Upper subscapular? Lower subscapular. And what is this? Thoracodorsal. Radial. And what is another nerve? Axillary nerve. These are the branches of posterior cord. So one of them, thoracodorsal, is supplying to latissimus dorsi. Look at this. Latissimus dorsi from here is going to the humerus. There is no attachment over here. Here is the attachment, but there are some fibers are there. So this is insertion. What should be the movement of this one now? The movement of this muscle.
Rotate.
It rotates and it Adduction. Adduction. Now I will ask from what two students, they are very interested. Can you produce the movement? Is movement is on insertion or origin? Can you produce the movement on origin?
Yes.
This is very, yes, how? Who is saying yes? He will hold, his arms on a bar when he is contracting because it's now fixed. He is not able to move. What will happen now? His trunk will be elevated. You are doing some exercise. So you are producing movement at origin. How can you produce the movement at origin? You have to fix the insertion. He has fixed the insertion. Jazakallah khair. So this is insertion, you are producing the movement. What is the nerve supply of this muscle? Thoracodorsal. So we have done the back muscles. Actually, I was planning to explain you in a half hour in a lab. That's why. My name was not there, but I will be there inshallah, no problem. In a lab. Don't miss. I'm sure that you will be very happy when you will listen to us and bring your notes. It will save your time and everybody will get an A+, I'm telling you. Don't miss the lab. These are very important. And try to ask the questions like that. He's asking what is superior articular process. No problem. Don't make any hesitation. But I need from your side your intention. Only this I need. That's why I'm fighting. Otherwise there is no, I'm not cutting the marks. Just only fighting for your benefit. Okay? So please have a 10-minute break. And inshallah, I will come back. We have a time still.